Hello and good morning, at least good morning where I am at. Carmen here. I'm going to be talking in this video about 3 things to consider when you're choosing a frenectomy provider. I am working with lots and lots of new clients, and especially because I work with them around the world, I find that I'm doing more hand-holding when it comes to finding a frenectomy provider. So first, I'm just going to really go over 3 things. There's more than that, but I like to narrow it down and keep it easy. So the first thing I want to say is, when you are considering who's going to do your frenectomy, the first thing I think you need to know about this office or ask is, if you're an adult, do they see adults? Do they regularly do frenectomies for an adult? What I'm finding is a lot of my clients are contacting their pediatric dental office, or they're contacting the place that did their kids release, and sometimes they're turned away, which is okay. And then sometimes they're told, well, yeah, we generally do infants, but sure, we'll go ahead and do yours. I don't like this idea. And part of the reason is there is a big difference between doing a release on an infant when they're generally doing a release for a for a breastfeeding issue versus doing a release on an adult. I've said this before, exactly 0% of my clients who I see as an older child and they had a release as a kid, exactly 0% have not needed it done again. That's just my experience with my clients, okay? So the first thing I want you to know is, do they see adults, okay? If they don't and they turn you away, that's good, because I always tell my clients, I don't want you to be a guinea pig, okay? So that's the first thing I think you need to know is, are they going to be able to service you? So whoever you're thinking about that's going to do the release, will they see you, okay? The next thing is, do they require or recommend myofunctional therapy? Now, obviously, as a myofunctional therapist, I see what I like to call the dark side of having releases, not doing myo. I prefer, obviously, I'm going to want to work more with offices that require myo because I know the end result. I know that person knows what the hell they're doing, what they're talking about, if they're not going to even let you schedule without having myo, okay? I have lots of providers that are like that you can't even make an appointment without having my report that you're in therapy, or, a therapist, a report, not just from me. Most offices, however, will recommend it. If you go to an office, if you're thinking about having, your longtime family dentist do your release, and you go to you get your assessment done, they offer to do it that day. They never talk about myofunctional therapy. You're going to make a bad choice, okay? There's no way to sugarcoat it. Yes, you're going to find people out there that can tell you, oh, I did it, and I did it just fine. I didn't have myo. I didn't do A, B, and C, and I turned out just fine. And that person could be that one person, that oddity. However, I meet so many people who think that they're okay, and they're not. So they're better than they used to be, but they're not as good as they could be, okay? So don't take that as a get out of jail free card to do it to have a release without myo. It's highly, highly not recommended, okay? If you go to an office and they don't know anything about it, they don't recommend it, they don't say anything, or they tell you that it's not necessary, it's not important, that's the wrong office for you, okay? I tell my clients or my potential clients to get out of that building, run like it's on fire, because that's not your person. You're not going to get a good quality release, and that's just the truth of the matter. I've never had somebody get an accidental really good release, okay? It's generally the other way around. If somebody comes to me, they've just had their release done, they had somebody who didn't know or understand myofunctional therapy and they didn't mandate it, or even talk about it, that person did not have a fantastic release, okay? And then last, the third thing is I would be asking what their post-procedure recommendations are, or not recommendations, their post-procedure wound care. If you ask your doctor about this, you guys, this is one of the most important things. People ask me repeatedly, what's the most important part about this process? And really, I feel like there's 3 phases. We have to prepare for the frenectomy. You need to heal properly from the frenectomy, and then we need to do the rehabilitation after. Every one of those is a distinct phase where I focus differently, okay? So when you ask the office about what their aftercare instructions are, what their wound care is, what their active wound management, any of that, and they look at you like you've got 14 eyeballs, again, you're not dealing with somebody who should be doing the job, okay? I have to have you heal properly from the release, or we're back at square one and you're doing it again. So you don't want that. So those are 3 considerations to think about. Do they see adults? Somebody trying to call. So do they see adults? Do they require or recommend at least know and understand myofunctional therapy? And then what is their post-procedure? What's their wound management? Do they give you stretches? Do they talk to you about how to take care of the wound? Or do they just do it and send you on your way? Which is, again, not the right person. So last, before I answer a couple questions here, 3 things that I like to tell people who I am considering doing therapy with, okay? So this is just food for thought for you to think about if you're an adult, okay? Be willing to travel. This is a big one. I'm here based in Colorado. I have people come from 5 states away to see my Colorado provider. I have somebody in Montana. People travel all over to see him. I have airway ortho that I use in Wyoming. All of my Montana clients travel to Wyoming for airway ortho. So you have to be willing to travel for the right person. I always like to use the example, I know we're talking tongue ties, but if you found out that you had, some terrible diagnosis, would you not seek somebody who was specialized and knew what they were talking about, okay? So be willing to travel. Find your myofunctional therapist to guide you. Somebody here asks, my mommy chronicle says, how do you figure out you have an issue as an adult? You get a myofunctional exam, okay? So that's what I do. Finding your myofunctional therapy person is the best choice. We are the ones who are experienced and have the expertise to help guide you. Do we know it all? No. But we help you develop, the plan of who you need on your comprehensive health team. Do we need an ear, nose, and throat doctor? Do we need an allergist? Do we need a sleep doctor? Do we need airway ortho? You can jump into any number of Facebook groups that are talking about tongue ties, and you're going to get a lot of advice. You're going to get a lot of opinions where people may or may not be giving you the best advice. You might be getting an opinion from somebody who does not have the basis or the expertise to be giving that to you. So find your myofunctional therapist. I always say you have to find somebody you know, like, and trust, okay? If you're not a good personality match, don't work with that person. So many people jump ship, come do therapy with me, and they're really upset that they went with somebody else who they just had a bad feeling about. They didn't have a good gut, a good feeling. Follow your gut, okay? So find your myo. That person's going to guide you. Every single time I do an exam with somebody, I tell them, okay, first we need to do this, first we need to do this, then we need to do this. I give you those steps. So going back to talking about how do you find out whether you have issues as an adult, you get an exam. I write a report. We evaluate all of your symptoms, what your goals for therapy are. I work on 4 different areas: tongue posture, mouth posture, nasal breathing, and swallow correction. It's as easy as that. On my website, there is a getting started guide. There's all sorts of tools that you can download that help you know where to get started. Okay, so that getting started guide is really, really helpful. The last thing I want to say here, and don't take this the wrong way, I'm just going to say it, don't be cheap. Okay, don't be cheap and cut corners. So I always tell my clients or potential clients that I'm thinking of working with, who are adults. When we're talking here, I'm talking about adults because that's a little bit different. You don't have to jump out of the frying pan into the flame. So if paying for myofunctional therapy is a burden for you right now, don't do it the wrong way. Don't cut corners. Don't just go to the family dentist down on the corner. Save the money and do it correctly, because you are going to have much better outcome. You're going to not regret your decision. And lots of my clients, they kind of set up like a layaway, a payment plan, so that they can get their therapy paid for and then do everything correctly. So when we're talking about children, there's that time-sensitive window when we want to make corrections before the face is developed. But as an adult, you're already damaged, really. So you're done growing. We're not going to make huge changes there. That's not to say that you won't need those type of interventions, but if finances are a concern, don't be cheap. Do it the right way, okay? So I hope that helps. I see one more question here from my Mommy Chronicles asking about advice for a 2-year-old. So a 2-year-old is really not at a good age, because a 2-year-old is not old enough to comprehend, comply, and cooperate with therapy. Again, find a myofunctional therapist who can at least guide you. I don't start therapy with kiddos that young, but I have lots of conversations with parents so that I educate them on what we're looking for, how to find or watch for misguided craniofacial growth. Again, on my website, you can find the 6 things. It's a lecture that I did. It's the 6 things that every parent should know about craniofacial development. Watch that. It's going to really be helpful. But a 2-year-old that has a tongue tie needs to wait until they're old enough to comprehend, comply, and cooperate with therapy. Okay, so that's all I'm going to talk about in this particular video with the question about considerations when choosing a frenectomy provider. And I will be back again soon with another topic to talk about. Thank you. Talk to you soon.